before we dive fully into the collaboration between Conversa and Northwell, Wes, I want to come to you.
Okay.
You're a 5-time serial entrepreneur. You're a CEO of Healthline. You've led an IPO, some acquisitions, and now you're back for more. You
Glutton
just
for punishment.
Glutton for punishment. I was going to say, what compelled you to start Conversa?
Well, I mean, Phil and I started the company because we saw what we thought was the largest gap in healthcare. I mean, this appalling lack of communication between care teams and their patients. And it's not just the communication, the data exchange is just almost non-existent. And so let's face it, I mean, at the end of the day, the care delivery system is broken. Whether you're a provider, payer, pharma company, you all have these episodic, ill-informed, expensive interactions with your customers. And it makes it impossible to scale any kind of care delivery across populations. And so, we have kind of set out as a mission that conversation really is the cornerstone to transforming the doctor-patient relationship. And so if you think about conversation, it's what we do all week. It's how we communicate with each other. It's how we get deep understanding. It's how we share our goals, our issues. Frankly, it's the currency that allows you to kind of get deeper into the patient journey and be able to actually understand what has to happen. So we built the platform that essentially delivers automated virtual care using these trusted, clinically intelligent conversations. And it's been super exciting. I mean, we are seeing tremendous results. We'll talk about that in a minute with Northwell and others. And at the end of the day, great products and companies are built with great partnerships. Northwell has been, and Zena, thank you so much for flying out here to help tell the story. I mean, they had been, for 3 years, we've been working with Zena and her team in really looking at the product market fit. They're dealing with issues that every single health system in the country is, and we've been pretty excited about what's happening. So thank you.
You're welcome.
Yeah.
So let's dig into some of those issues. Can you tell us a little bit about your role and what were the challenges that you saw within Northwell that led you to step back and say, I think we need to partner up with somebody on this?
Sure. I'm a vice president of population health for Northwell, which is the largest healthcare delivery system in New York State, about 80,000 employees. So my role really for Northwell is to do this, to sort of fix what Wes was just outlining, which is, in healthcare we become incredibly transactional. So my role is wherever we have an arrangement that is about the clinical outcome for the patient, and whether that's a readmission rate, an infection rate, a experience of care kind of rating, my team is charged with either doing the analytics, the clinical deployment, or the administration of that program. So one of the things we really, for our hospital, we have 23 hospitals, nursing homes, this issue of sort of readmissions, right? Hospital systems have never been incentivized to work on that problem because the more people are admitted to the hospital, sort of the more dollars your hospital system makes. So we created a system with nurse navigators, and it worked perfectly well. It works great. Patients love it. They feel known. They feel connected to the hospital. We have keepage. But when you say, how do I scale that to 1 million discharges a year, to hundreds of thousands, you get to a point where you can't just keep hiring navigators. But you don't want to miss out on the opportunity to, one, get the clinical outcome. That's the most important thing to your organization and also to the patient. All of these readmissions, infections, that's sort of representative of human suffering. So when you have something that works and where the patients are responding, you need a partner that understands, like, no, it can't just be an app. It has to be an app where one, the clinical outcome is still happening. 2, the patient experience is still there, that they still feel as connected to the organization as they did when they just had a nurse practitioner coming to the house. And it has to do this other thing where you're scaling this in an incredibly reliable clinical way. So Conversa has been a great partner in working with us to get there, and really the outcomes have been really incredible and have exceeded what we sort of, in a very almost myopic way, hope to achieve.
So let's pick up on that, because you mentioned clinical outcomes a couple of times. So how do you actually judge the success of that particular outcome? What is it that you were looking for? And then what were the outcomes that you actually got as a result of partnering up with Conversa?
Yeah, and let's definitely jump in, but I mean,
Well, I will.
well, we are very disciplined at Northwell because, and I would imagine all other organizations are, which is you can't just sort of be doing tech because it's fun or it's cool or the patients like it, right? So for our use case, it was this problem that every hospital is trying to solve. Why? Because excess readmissions sort of count against you in your hospital star rating, which has many downstream implications about your market share, your contracting. All hospitals that accept Medicare are also getting penalized for excess readmissions, not just across that readmission, but against the total Medicare population. So you've got to manage it there. Every payer contract has performance clauses in it around readmissions and hyperutilization. So this became a use case of, hey, we have these readmission rates, they have to get lower. So that, I'd say, as a sort of a hard stop on what had to happen, that's the hard stop. And then the other parts of the triple aim, which is what was the patient experience using this platform? So, part of the platform is that it's measuring how does the patient rate these conversations? Do they feel that these conversations have been helpful? Because let me tell you, if that number ever went south of 90, we're out. I mean, that's how important that relationship is. I mean,
Which, by the way, it's 97%.
I was just going to ask.
So, yeah, I mean, this is, at the end of the day, if you don't engage the patient, they're not excited about the experience, you're just not going to go anywhere with any of the digital health products out there in the marketplace. So, we had the very first set of populations that we dealt with Zena were Medicare Stars patients. These are old, very complex, sick patients that are sometimes, 60, 70, 80 years old, right? And so the ability for us to actually reduce the readmission rate, right now it looks like over 30%. We're ground truthing it. Some of the higher acuity patients, some of the cardiology patients look like it's closer to 50%. Those are big numbers.
Yeah.
And so the ability for us, we're now rolling out across about 14 different service lines across all of Northwell. And let's use oncology, for instance. So just radiation oncology and head and neck, 88% reduction in termination of treatments by the fact that they're understanding how to manage their symptoms, they're being able to communicate with their care teams much more proactively, and they're staying on treatment. And you stay on treatment for head and neck, that's a mortality issue. Yeah. So, and we're rolling out, OBGYN and all the Cancer Institute, and I mean, we can talk more specifically about where this is going, but.
Yes, I think it's what I have always been fascinated by with Conversa is how diligently you have been able to create the technology that enables that patient satisfaction to stay at 97, that does enable people to feel that connection while still staying compliant and adherent to their protocol. Wes, how did you guys go about developing that?
Yeah, the key thing here is it's got to be personalized. It's got to be timely, relevant, personalized, and asynchronous. And so the ability for us to deliver a personalized virtual care conversation, it's got to make sense to the person. And so we have a very robust profiling engine that allows us to take data from the EHR and the care management system, and that drives what we ask, what we say, when we say it. And so it's not just a generic reminder or survey. I mean, this is a very relevant set of interactions that they're having, and it's an extension of the care team.
And it's also the partnership. I mean, I think that is the power of this partnership, right? Because everything you said, yes, and then question on day 5, the patient's like, this thing asked me a weird question. So our ability to feed back to that team, hey, here's how the patient is interpreting that, and for that relationship to allow a revision of the conversation. Another example of that is, right off the bat, it's like, listen, these are not 25-year-olds, or it is patients who oftentimes are being cared by a caregiver. We need a caregiver modality on this. We need these questions being asked to the caregiver. So we have conversations that are for the caregiver. And that's another, and again, you know the platform's working because it's not just doing the thing you want it to do, but it's informing how you deliver care. It's actually changing how you deliver care. So an example, in terms of the caregiver conversation, is we suddenly had these caregivers calling and being like, this thing is asking me all these questions about mom. I don't know the answers to these things. And it was like, hold on. We're identifying caregivers in the hospital. We're saying this person has support. And it turns out the caregiver, the daughter, the son, the neighbor, they have no idea what to look for, right? They're like, I saw them today. I didn't ask them what their weight was. I didn't ask them if their breathing was good or bad. I didn't ask them how they slept. So it was this whole thing now saying, we need to not just educate the caregiver, but let them know specifically when you check in on mom, here's the 20 things, because Conversa is going to be asking you those things.
Right.
They're going to be asking, do you feel better or worse than you did when you left the hospital, right? It's such a basic thing. So I think that partnership and that collaboration really allows both the delivery of healthcare, but then also the platform to move forward.
Yeah, I mean, no one's ever looked at and said, what do I ask in between visits? Right? You know what you're doing in a face-to-face episodic visit? So developing the conversation modules, we have over 1,000 of them now, that built in the clinical protocols, they built in the escalation pathways. We have our own clinicians in our content development team, but we work with our partners to basically configure and fine-tune, understand the proper way to really drive that behavior. And so we use behavioral science techniques that allow us to have empathy and be able to have the conversation drive behavior. That's having huge impact in terms of the engagement rates that we're being able to see.
And Polina, I just wanted to back up on sort of that other piece of how do you, what is your ROI? What are these outcomes? I mean, I think the third thing we didn't get to yet was really the provider. How is the provider experiencing this platform? And again, that was sort of the first thing was, whatever this is, it cannot disrupt this incredible cadre of people I have doing this work. It has to feel additive to them. So one of the things that was unexpected was our provider said, you want to know what? I would have been calling this patient, 3 times a week, 2 times a week, and now because I'm seeing that they are greens across the board in this conversation, I might call them, but I'm not sitting here worrying about it. I was like, what do you mean sitting here worrying about it? They're like, that's it. I have 100 patients and I'm worrying about all of them. I can now look at the dashboard, and if I can see a sea of green responses, the worry is down, and I can focus all my care and concern on these folks who are answering yellow or red.
So that's critical. To optimize the care team so they can scale and give the guidance and support to the patients that need it, as opposed to those that are doing fine. That's turning the whole relationship and the whole notion of care delivery upside down.
So you mentioned care team. So I'm assuming that the 80,000 employees, or hopefully at some point all of them, do have access to the Conversa platform. It's not just one singular provider that does.
Right. So 80,000 is all of Northwell.
Right, exactly.
We'll get there.
That's soon.
Absolutely.
You got it.
Yeah. So it is this. What is we were just talking about this before, which is the platform is infinitely malleable, which is how we sort of decide to partner with Conversa. It wasn't about, okay, this does Medicare fee-for-service CHF patients. This thing does our CHF patients, it does our joint patients, it does our cardiothoracic patients, our rad-onc patients, OB, peds, sort of. And because at the core of it is this thing where it is pulling information so that even in that list of patients who are all green, they feel like someone's taking care of them, which we are. Yeah. But it's because they're having this conversation 3 times a week. They're like, at the end, their feedback is, wow, you guys were just really right on top of it that whole 30 days. And it's like, yes, we were, right? But it's because they were just having these conversations and feeling empowered and feeling like somebody was out there watching, even though sort of the watching was really watching for any abnormalities in their responses.
Yeah, so the connection piece is really important. You kind of feel it as you start to use the platform. But how does it work with that very first conversation, or the conversation that you say, okay, we are going to be using Conversa for our relationship moving forward? How does that conversation play out with the patient, and then how does it also play out internally with your different provider groups?
Yeah, I mean, certainly, we'll put it all out there, which is
Yep.
this is the best powered when it is authorized by your clinical teams, right? When they're saying, this is not some new thing, why don't you sign up? But this is how we take care of people now.
Right.
I want to be
Yeah.
way more on top of what's going on with you for the next however many weeks. Go ahead, let's get your email, your cell phone, however you want to do this, and let's get you signed up. And it's that's key.
That's critical.
There's no app here. It's web-based, so there's no sign up. It just launches. And it launches with all this specific matched information. So that is really, really important.
Yeah, so activate and onboarding patients, activating physicians. I mean, we've learned a lot over the last 3 years about using our client success and operations group to train, and I mean, there's change management going on here. I mean, we are providing constant, ongoing, collaborative feedback with the patients, and there's data, and you should do something with the data. I mean, you can talk a little bit about what that means in terms of your care delivery and escalation strategies.
I want to even bring the data back to this issue that you just brought up, Polina, which is, in the beginning, when you're talking to providers, providers want to know the thing works. Providers don't want to get their patients on something because it's like the shiny toy of the month. So, part of our iterations was being able to show, look at how much your patients are benefiting from this. Look at how it makes them feel about your practice, about this team, and then this conversation about this is just how we take care of patients becomes very easy.
So the mark of a really good collaboration or a really good partnership is that collaborative engagement, which it seems like you guys absolutely have. But it's also the expansion of that partnership. So what's next for the Northwell and Conversa relationship going forward?
Well, as I said, I mean, we're super excited. We're expanding across all 23 hospitals and 14 different service lines. So very active. I've got multiple people dedicated to these guys. They have a vision of driving conversations across all their 2 million patients. So we've got some work to do here, but ultimately, whether it's OBGYN or the Cancer Institute or emergency department, I mean, they're going to be managing the relationships using Conversa, and that's super exciting.
So it seems like over, hopefully, quite soon, if you happen to be in care in a Northwell or institution facility in New York State, you're going to be using Conversa, and that's pretty exciting.
Well, the good news is you'll be able to actually, if it's UCSF or UNC or DaVita, we've got 20 customers all now adopting it, and these guys were the ones that kind of led the way. So thank you again, Zena, for everything you've done.
And we'd like to thank both of you for this conversation, particularly because I think it expands the way in which all of us experience our care and really being able to feel connected to our providers throughout our health journey. So I'd like to thank both of you for being here.
Great.
Thank you
Thanks,
so
Polina.
much.